on data-related issues that you may well wish to hear and countries specifically may well have asked for. So this is your opportunity also to make a pitch later on during the call if you want to have webinars later on this year. This specific webinar is about and led by Pandula. It's about the reasons why partnerships are so important in the data-related field. And as Pandula has hinted, with the current crisis going on amongst many of the development sector, we firmly believe that partnerships help align resources with country priorities and also is a more efficient way of doing things, coming together, collaborating, sharing resources, whether they be financial, technical, or political resources for country efforts. And you'll hear more about that and the Health Data Collaborative efforts in that. This specific webinar is also about the country partner mapping tool that Pandula and many colleagues have helped to lead. It came about from a demand from countries really to better understand what partners are doing, which partners are in different countries, and how best partners can come together in countries to align their resources with country priorities. And this mapping tool, many of us feel, has the potential to help partners, and more importantly, ministries of health and ministries of finance, understand better the partner landscapes that are emerging in different countries that are investing in and supporting different data priorities with an ultimate goal of reducing fragmentation and aligning resources with country priorities. So again, I wanted to thank you all for joining today. I want to thank you especially Pandula and Isabella for supporting the Secretariat function of the Health Data Collaborative. And we look forward to your thoughts and suggestions of improving this tool and your contributions to the Health Data Collaborative. As I said at the beginning, it's your collaborative. And we'll also be hearing from country colleagues that have joined us from Sri Lanka, Togo, and I believe other countries as well. So with that, thanks very much for everyone for joining. Back over to Pandula to help set the tone and start the webinar. Thank you everyone for joining, and thanks Pandula.
Thanks, Trent, for that introduction. So without further ado, again, a warm welcome for those who have just joined in. Let us start off the webinar. As you can see, the resource persons for today, joining myself, Isabella Mina, who is a consultant to Health Data Collaborative, a service delivery systems of the WHO, currently based in South Sudan. We have Dr. Pradeep Silva, a board-certified consultant in health informatics, representing the Ministry of Health in Sri Lanka. And then we have Ariel Nagem, Strategic Health Information Officer from the WHO Togo country office. May I please invite Isabel to start off the sessions. Isabel, over to you.
All right. Thank you, Pandula. Good morning, good afternoon, good evening from wherever you are joining us from. We appreciate you for joining this webinar. So this webinar, as you've heard, is hosted by HDC. I think the first question from the participant would be, what is this HDC? And just to let us know, it is a partnership that brings members, partners together with the aim of strengthening countries' health information system through effective collaboration. So basically, partnership that will help us move together to enable us achieve our health development goals. That's the SDGs. We have over 1,100 members from over 430 partner organizations. And what the partners bring together is technical advocacy and also financial resources. Next slide, please. So why does partnership matter? Why, for example, did partners come together to form the HDC? We know that different partners, be it government, be it funding partners, be it the ministries of health, be it private sectors, have different strengths. So we have this word cloud here that summarizes some of the strengths, funding, for example, technology, especially in the private sector, innovation, especially in the private sector, leadership, for example, from government colleagues, the ministries of health, ministries of statistics, and so forth, capacity strengthening, Other partners will bring in the strength of advocacy, infrastructure. Others, for example, those working at the country level, the issues of localization and also governance. And we know that when these come together in building partnership, the result is that the diverse views of those partners are brought together, that they are able to encourage peer-to-peer learning, learning from each other. Those who are savvy with technology will enable the others to learn and so forth. Then leverage the resources, and we've seen in terms of HDC, the three kind of resources that we leverage from the partnership. That's financial, technical resources, and also advocacy. And then with that, we build common agenda. And our agenda in HDC, for example, is data and health information system. And the focus is to strengthen action at the country level, but then informed by the country needs. In this case, for HDC, the need for data and HIS based on what countries map in their country-specific plans. Next, please. So how does HDC work? We've seen that we have over 1,100 members, 430 organizations, drawn from three levels. That's the global level, the regional level, but also at the country level. Different types of stakeholders, that is countries, we have civil society organizations, and I believe in this webinar, we have participants from all these constituents. We have the private sector, we have global health initiatives, for example, the UNIT 2030. We have academia, universities, and we have donors and so forth. And then HDC works through working groups. Right now, we have 7 technical working groups. We have the digital health and interoperability. We have data and digital governance. We have routine health information systems, CRVS, GIS, community data, and another one that is more of community of practice called the logistics management information system. And the idea is to leverage strengths from the different stakeholders. Here we give the example of the participants in the data and digital governance working group. We have participation from all these organizations that you can see. For example, the CDC, PATH, Transform Health, and all the others, as you can see from these logos. And how the working groups work is they will work with countries. Countries will define their priorities, and later on, we'll have a presentation on how we engage the countries, ensuring that the priorities are coming from the countries that we work with. Currently, over 20, actually close to 30 countries currently. And then the working groups then will address the needs of those countries through alignment and resource mobilization. It could be technical support, it could be providing global goods to countries, for example, guidelines, also providing a platform through which countries share with each other, for example, peer-to-peer learning. And we have examples later on that. Next, please. So HDC, what is the experience so far? This partnership, what has it brought on board? One is that HDC has provided a consultative forum for all partners, and it's in the three levels. Partners at the global level, members at the regional level, and also at the country level. It has provided a platform for peer-to-peer learning, as we are doing today. More often than not, we also bring countries to share experiences through our meetings, for example, HDC annual stakeholders meeting, but also organized meetings between countries. Also collaborative development of global goods, for example, the data and digital governance working group has developed a health data governance framework just to guide countries to adapt such a framework accordingly and align it to their country context. Then also linking with the digital transformation, we know that we cannot separate data, health information system and digital, the digital transformation that is happening globally for purposes of efficiencies and so forth. And of course, setting up in-country partner coordination. That's our main aim actually, that for us to have better data for us to have a better health information system, for us to ensure that we have quality data to inform progress on health outcomes. Then we need coordinated efforts at the country level, and therefore HDC encourages and works with countries to ensure that there's better coordination, that the structures for data for data coordination at the country level are working. For example, the MNETWGs, some countries have HIS-TWGs, others have CRVS. Basically, the partnership structures for data and health information system. We do host advocacy events as HDC and also adopt agendas that are aligned to country needs. For purposes of this meeting, we focus more on mapping of country partners. As Craig has said in the beginning, basically is to look at who is doing what, where, in terms of investing in data and health information system, so that we have more aligned help in addressing the country needs. Next, please. So allow me to hand over to Pandula to take us more on these country partners mapping and where we are on that. Back to you, Pandula. Thank you.
Thanks, Isabel. As Isabel quite elaborated on what HDC does in terms of partnerships. And the next phase of this session will be with regard to identifying partnerships that matter and how we have gone through that process. Some have worked, some haven't. But to share with you that process initially and then listen to our country colleagues in terms of what impact or how has it changed, if at all, the practice in country as we adapt these approaches. So I will take a step back and revisit the problem in a country setting as we exchange our views with the country officers as well as other partners who are established in those countries. One of the key problems that we again and again hear is that many of the partners as well as state agencies, but particularly the ministries of health, may not be aware who's doing what. There may be many partners in a country who are contributing to health information systems, data systems, digital health. But many of those activities happen in isolation. And unless there is a mechanism to share that knowledge or to proactively seek that information, then many of the countries or colleagues from ministries of health as well as from partners, officers, felt that they are not really aware of what the others are doing. And in many instances, many of the colleagues in country or ministries of health in countries were not able to create a bigger picture or the whole picture related to HIS and health data and the investments that are going in. Again, highlighting the issue of fragmentation and isolated systems that are being supported by different partners. So when it comes to partnerships that matter, we realize, as many others have, that knowing is power. And this knowing is referred to as what the other partners or state actors are doing in a country in relation to HIS, health data, or digital health. Now, another step with regard to partnerships that matter, as we realized, was what kind of a framework we could use in order to measure this. So when we talk about mapping, there may be different ways in which you can map development aid or development activities in a country. And many agencies, many organizations use these different frameworks in relation to identifying or landscaping what the partners are doing and identify where the gaps are. When it comes to HIS and health data, what we realized is that there is already existing information that we can actually use. And that kind of led us to identifying 3 key things that we should use in terms of mapping in order to identify partnerships that matter. One of the things is the health data gaps that are recognized in countries. And one of the resources that we had were the SCORE assessment, as you know, which first happened in 2019 and is now going through the second phase of it, where the countries proactively look at different variables, different elements, and identify where the strengths are, where the weaknesses are, measure them, rate them, and then see how best to overcome these gaps using different tools and processes. So that's one of the items. The second is the priorities that are defined by the countries. And many of the countries have undertaken different approaches to defining their data or HIS priorities. But in many instances, it's realized that these doesn't really become basis of decision making or strategic decision making, both in country as well as by partners at different levels. The third is actually the interventions by the partners. So when it comes to mapping, we realize that these are the 3 key variables, not to say that there aren't other variables or aspects that could be used in terms of mapping, but to the scope that we were aiming and what the countries were and the stakeholders were requesting, we realized these probably would be the 3 key things for us to start off with. Now, the next step again would be for any mapping activity, and specifically when we are talking about partnerships that are important or that are meaningful, we also need to find a framework that helps us look at each of these variables in a standard way, in a consistent way. Otherwise, we won't be able to map between these different elements. So we turn to the SCORE, as I said earlier. SCORE is an assessment that, as I said, happened now twice. The second round has been, the second round has also been done. Many of the countries have submitted that data, and those data is being reviewed. So SCORE, as you know, has 5 key areas: the survey, count, optimize, and so on. And each of these areas kind of breaks into multiple different elements. For example, the survey has 3 key elements in its original version: system of regular population-based health surveys, surveillance of public health threats, and regular population census. So similarly, there are multiple elements in other SCORE areas as well. So what we did was to bring all these elements together to create a matrix of SCORE elements that will help us to classify each of those variables that I mentioned there. In addition, we also adopted keywords that would help us go into more granularity when it comes to different interventions or the priorities that the countries define, so that we can be more, that information gathered would be more useful for partners as well as for the countries. So what does this mean? What's the value add of this kind of a mapping exercise or any type of a mapping exercise? So what you see here is a hypothetical scenario where you see the SCORE elements that we have used, S1 to E3. For the time being, we'll forget the definitions or the names related to each of these SCORE elements, but this is a hypothetical scenario for us to demonstrate. You see that there are gaps in relation to, for example, elements O1 and E3. You see priorities the countries have defined in relation to different other SCORE elements, and then you see the interventions by partners in relation to certain other. What we see now here, in one instance, there is a gap, there are priorities, but there are no interventions by partners. So there's an opportunity that partners can intervene and support a particular country. In some instances, you may see a partner investment happening, but that happens without taking into account the gaps nor the priorities, which essentially then allows any partner or a collaborative to look at it and say, okay, are we really investing in the right place? Then in some instances, you may find that there is a gap recognized, for example, through the score assessment, but there are no priorities defined in that particular area. This may be context specific, but that also allows internal discussion within ministries of health or any other state agency and among partners. Can we kind of relook at our priorities, or can this be used as a way of defining priorities and so on? Then in other instances, you might see priorities defined, but then again, unmet priorities, which creates opportunities for the partners to collaborate and support. So this is the value add that it would bring when such a mapping exercise is undertaken. Now, any mapping process happens in isolation may not really serve much purpose, because you can map, you can document, you can publish, and that will remain in the web or in some other place, but it may not really actually be used in terms of action. And that is where the partnerships that matter really take place. So the approach here was we engage with countries through the country engagement strategy of the HDC, which basically allows countries to have a dialogue internally, plus with the partners, maybe by establishing in-country coordination mechanisms or reactivating existing mechanisms that will then lead to a process where a country partner mapping tool will be used in terms of defining the landscape of different partners and how they actually contribute. The second phase of that is, once these are recognized, then it allows the working groups of the HDC, which consists of multiple partners, professionals, institutions, and so on, to look at these gaps, to look at the priorities defined by countries, and then take action to mobilize resources, which may not necessarily be funding, but in terms of human resources or in terms of advocacy that can then support these efforts. So without going into details, I will quickly take you through the country partner mapping tool and where it stands now. The tool was introduced several months ago. About 20 countries have been sensitized, have initial discussions, have started working on it in some form. At the moment, about 10 countries have created their own profiles, which means that they have defined HIS or health data or digital health priorities as it fits within that particular tool. And about 2-3 countries have started the process of inviting partners to share their inputs into the, share their interventions within the system. So we start seeing some activity within the tool as of now. You see the countries emerging who are creating profiles and who are creating, bringing in partners to share what they're doing in countries. You also start seeing where the partner contributions are mostly made. Must mention that given that we don't still have a significant amount of data, what we see may not really represent the accurate picture. So with that disclaimer in mind, we will be able to kind of see where the partner contributions are most being channeled. And then when it comes to score, we also see which areas of the score that partners are really interested or are contributing more, and whether these support can be classified in terms of funding, technical support, or advocacy. It may also be useful now to see whether there is a trend in over time in a country in terms of what the resources being brought in. We also start seeing a heat map of where the partner interventions are really focused on. You may find certain areas in score that might not have much interest or investments from partners in areas. Some areas you may see more when compared to other. But again, this will require a lot of info in terms of a country to see a more accurate picture. So from a country perspective, similar to the hypothetical graph that I showed you, we start seeing where the different partners, for example, this is in Sri Lanka, where the different partners are investing in, This may be funds, this may be human resources, technical expertise, or it may be in relation to advocacy. And you can see where in the score elements that these investments are, and you can also see where the investments may not be going. So superimposing this with the country priorities, with the love countries, to see are we in the right track and whether those partnerships really matter in that context. Again, in Nepal, something similar. You can see how the partners are contributing into different areas. And then this is another example of what countries and partners could gain. For example, to see which partners supporting in the Zero region to supporting the DHIS2, and you can see multiple partners engaging in it, which essentially allows both partners as well as countries to seek further collaboration, seeing that some of the partners are supporting similar projects in different countries would also allow other countries to reach out, partners to reach out to other partners, as well as to build more effective collaborations. So that's a little bit about our experience from the HDC Secretariat's point of view, and the tool that actually kind of we deployed and adopted by countries. It's not has been all smooth sailing, I must say. There are different perspectives into how this approach or mapping exercise, let alone the tool, need to be adapted. It requires multiple deliberations, both within the Ministries of Health and other state agencies, as well as among partners. Because what we tried to achieve was to create this culture of sharing information. And to an extent, we have been able to succeed in some of the countries. So without further ado, may I please invite Dr. Pradeep Silva, who's a health informatics consultant in health informatics from the Ministry of Health, Sri Lanka, to share the Sri Lanka's experience. Pradeep, over to you.
Thank you, Pandula. Thanks, Craig, and everybody. Good afternoon, good evening, good morning to everybody. With regard to this creating partner collaboration and meaningful partnerships, and also trying to align what the country needs for health information and digital health, to align those with the partners' activities. What we thought at the country level was to create a partner collaboration mechanism. This was initiated with the Health Data Collaborative Initiatives, as well as the Ministry of Health and supported by WHO. So what we initially thought was okay, not to have big expectations, but kind of support what mechanisms are which are already there, like your partners who are engaged in different investments in terms of digital health as well as health information. They do have a certain collaboration even as we speak with the Ministry of Health. But overall, what Dr. Pandul also pointed out is some of these partners do not have the bigger picture as to what happens and the strategies of the policies of the Ministry of Health. So this alignment is crucial in terms of getting the benefits to the public or the healthcare sector. So initially, our objective was to enlighten or express the Ministry of Health policies and strategies to the partners. Tell them this is our direction. What are the thinking behind for the next 5 to 10 years, and the short term as well. So that's kind of the opening up what the ministry thinks about implementing different health information systems, digitalization of the information systems, including innovations, like incorporating AI and so on. So that kind of giving a view of that, and then of course have a stock of what currently these partners are doing within Sri Lanka. So different partners are engaged in different activities. We found out like so many activities have happened. Some of them which we are also unaware of, and in terms of the extent as to what is happening. So who does what, when, and to what extent, and what's the future of those activities? How can we link them to others? What's the next objective? So in identifying these objectives, we also wanted to identify how these partners can collaborate with each other in terms of speaking and getting them into one forum. Because all these conversations in the earlier days have come, kind of been happening in their own quarters. So what we want to do was, okay, get them together in terms of common objective, health information and digital health, and then talk about activities, further activities, and the collaboration as well. We also wanted to advocate the data governance aspects, which is crucial in the current age. Aspects of data sharing, different legislation that is required, different legislation that is already in place, and our commitment to those instruments, how we can adapt them and also leverage the benefits that they define. So all in all, this was the mechanism that we wanted to achieve in terms of aligning the partner activities to the digital health and the data health information activities of the Ministry of Health of Sri Lanka. Next slide, please. So let me talk a little bit about the priorities for data and health information systems and digital health for Sri Lanka. So we've kind of now shifted from the thinking pattern of institutional-based health records, institutional-based information systems to patient-centric patient portals and patient health information systems, where the portability of these information is carried along with the patient. So in terms of that, the Sri Lankan government and also the health ministry itself has embarked upon on a journey to create a national digital health platform. This platform, as you can see above, which is is defined in the blueprint for digitalization for Sri Lanka. And that carries the architectural diagrams. Some are very detailed, some are at the higher level, defining a national electronic health record. National electronic health record is our vision, maybe in the next couple of years to come, where a shareable health record for each and every citizen is created at the central level, which carries the health information from birth to death. And this health record will also have a patient portal, where the patient or the citizen portal, where the citizen can take health information, have his own health information, and make better health decisions. So this is the overall high level thinking that is happening within the Ministry of Health. And to enable that, we want to establish a national data exchange, NHDX, which encourages seamless data exchange between public health and curative health sectors as well as the private health sector. We are also very mindful of implementing health information systems as well as digital health systems in terms of the requirements for the infrastructure requirements that is required for these information systems. Sri Lanka is somewhat in an advantageous position where we have quite good manual and paper-based systems which have been there for a long time and servicing our systems, especially the public health systems, health information systems have been there for a long time. But digitalization is what we are going to do, and but taking into account that we have around 1,600 healthcare institutions scattered around the small island nation, it's a daunting task to kind of to have these infrastructure at one go. So it's a phased out manner improvement that we are planning. So partners can come and join all these activities and the digital health blueprint, which defines these activities. We also want to strengthen the governance mechanisms for digital health, especially the framework for data sharing and data management, and also adhering to the Personal Data Protection Act, the Right to Information Act, the Cybersecurity Act, as those compliance to these acts and governance structures and instruments needs to be there. Then one of the important things is to build the capacity, the workforce for these digital transformation process, and establishing a national level structure called the Health Information Bureau. We have already gone through the cabinet for this establishment of a national bureau, and that is also some activity that the partners can join in terms of providing us with specially skilled personnel that are required to man this unit. Then we are also thinking of novel activities like incorporating AI in healthcare. Telemedicine is something we've already we embarked upon. So these activities also can be assisted by partner collaboration. Different partners may be coming together and joining hands to give us these helping hand and the support that we need. We also talked about all these things in a very sustainable environment in order to make systems that we implement not to have uh, you know failures after the implementation. So we need to carry them forward. So the sustainability of systems is something also the partners can think of. Next slide, please. So lastly, I'll just let you know what we have done. Up to now, we have had 2 partner coordination meetings, hands-on sessions, utilizing the mapping tool that Pandul explained. Partner agencies have shared their activities and had a very fruitful conversation between partners. I must say this was an exercise that was really helpful in understanding the activities of the partners, the visions of the partners, their goals, and how the national blueprint and the digital health architectures as well as the health information systems can align all together. So opportunities for further collaboration was also seen in these meetings. A lot of partners were hyped up about, encouraged about the activities that they can perform in the future. So planning of activities for future activities, where as Dr. Pandula pointed out, some gaps were identified, some gaps. Some systems were there but not enough, so like so on. So this was a very fruitful exercise. Now we have come to a very crucial stage in Sri Lanka. We are planning the next stage for the national health policies. So we are planning for the 2026-2035 10-year national health strategy plan. So this was one of the key things I think that was very fruitful in terms of the partners that were engaged in. We took their views, we took the collaborative efforts and now we are trying to incorporate these into the upcoming national health strategy plan in terms of health data information and digital health. All in all, I must say this has led to the culture of sharing information and seeking opportunities where they can perform and with the support with the collaboration involved. So this kind of mechanism along with the tool will help us kind of visualize what is happening. So this is our experience I wanted to share, and I thank you for giving the opportunity for me to share this. Thank you.
Thanks, Pradeep. Thank you so much. Shall we also have Ariel? Are you there?
Yes, yes, I'm there.
Hi. The floor is over to
Hi.
you. Please,
Yes.
I don't know whether you have any slides. Do you want to share from your end or?
Yes, I have some slides.
Okay,
Sorry for
so
the delay. I have a very, very big technical issue
okay,
in here
so I
today.
think you should be able to share. Just double check whether you can do that.
Okay.
I'll stop sharing. Isabel, are you sharing or?
Okay. I think it's good.
Okay.
Okay. Thank you very much. Okay, for Togo, in 2024.
Arielish, can I just, sorry to interrupt. I think what we are seeing is a different set of slides. Maybe
Yes, ma'am.
I think Isabel, if you can then stop sharing, I think we can then. I'll stop Isabel. Okay. All right. We can see your slides, Ariel.
Oh, yes, it's me. Okay. For Togo in 2024, we undertook a strategic mapping for health development and partners involved in area of health data, digital health and service system. So the initiative was coordinate already, as you already said, all the partners, all the intervention to avoid duplication, and then the mapping was aimed just for us in Togo to develop a centralized mapping and also to categorize intervention for the national strategic document that is already here and for the upcoming national digital health strategy. Then the Ministry of Health and Public Hygiene was the lead of this exercise, and the really lead one was the Directorate of the Planning and Health Information. So with our support, with the support of the Book Country Office, so we provide, we share them all the templates to collect data partners, and we already do regular updating. But the problem is that partner doesn't respond very well as we wanted. So we already done a online meeting to make them understand the use how do you call it, importance of this mapping. So obviously some of them were okay, but they didn't already put the data in the template, so it was not easy. So we started to do another strategy And this other strategy is with the WU leading. So we coordinate a subgroup of digitalized of partners that are in digitalizing the health sector. So we convince them and show them all the information about digital health and how to use data for decision making. So we go through 6 meetings during 2024, and it is now in 2025 that they are already convinced to give information about what they are doing already and where they are doing it and which amount and all the activity and the objective of the activities and also the locality where they are doing their intervention. So I think soon we will have a very complete mapping for partner intervention in health data and digitalized data and service. But in this other way, we also conduct a meeting with all the partner on the to have a small diagnose of the CVS system. So they were there. They also give some information, but not all. So we use it, and now we have wanted to do now the mapping of the service system. And in the other way, the digital national strategy also on the ongoing process, and also the implementation of RCD 11 with NCUD and DORIS is also planned for 2025. So that is already that. So we learned that the leadership of the government is very essential, but using partner meeting is for Togo was a huge way to go through this challenge of confidence on the data. And we also tell them that we will be sharing the mapping results, so they will be aware of what and can already use it to coordinate or to harmonize all the intervention for the partners. So that is all I have to go now. Thank you for the floor.
Thank you very much, Ariel, for the brief on what Togo has experienced. It's interesting to know how different countries probably adopted its own mechanisms in terms of how partners are engaged and the outcomes of those. With that, may I please invite Craig again to take the floor to moderate the discussion.
Sure. Thanks, Pandula, and thanks, colleagues, for all your input. So the floor is open for any either points of clarification or suggestions on how to use the Health Data Collaborative for your needs, but also the mapping tool specifically. And we understand there are other mapping tools out there. We want to collaborate with others as much as possible, but value your suggestions. So the floor is open, and please raise your hand or feel free to chip in. I don't see any hands up just now, but I'm just looking at the chat. And I see, yeah, a quick question from Tewodros. Sorry for the pronunciation, to Pradeep. Have you seen an improvement in how the partners are coordinating and improving in how health services are provided? That's a brilliant question. Thank you, Tewodros. So Pradeep, the question is really, have you actually seen an improvement in how partners are coordinating and improving how health services are provided? Thank you, Pradeep. If you want to take that one, and I'll collect some others. Thanks, Pradeep. Over to you.
Yes, Greg. Yeah, thanks for the I think Pedro's. I just tried to answer on the chat, but more on that. Actually, what we saw in the meetings were that partners have kind of actively participated, actively wanted to find out what others are doing, whether there are overlaps in terms of the data initiatives that they're doing. So it is really encouraging to see that, and also some of the partners were unaware of the national level strategies and policies. So I think this was a really good forum for us to kind of dish out and say, okay, this is what we are doing. Are there any suggestions? What are your observations in terms of what work you do in other countries, and so on? And this also, it was a very fruitful conversation. We had 2 meetings, and I think going back to their offices and going back to their activities, I think they took something with them. So in terms of whether we have achieved health improvements, these are early days. I mean, but uh, uh, as opposed to the mechanism that we had earlier in the ministry, where each and every partner comes and does their own thing with different units. This is as opposed to that. This has kind of given us quite a better hope in terms of aligning the strategies and policies. I hope that answers the question.
Thanks, Pradeep. Thanks for that. So I see that Sarah Hollis has her hand up. Sarah, do you want to go next? Thank you.
Hi, everyone. My name is Sarah Hollis. I'm the Health Information Team Lead at the Nairobi Emergency Hub, which is covering East and South Africa. I haven't joined this forum in quite a while, so it's great to see everyone and see also some familiar faces. My question is somewhat related actually to Leonard Cosmos's question in the chat. I had a question for the Togo team on which partners were involved in the mapping exercise, and also what was the rough resource investment required for that. We're doing a lot of work on multi-country pandemic fund projects and a lot of things about multi-country cross-border surveillance. So we're trying to see how it would be possible to do such mapping exercises for a bundle of countries in the sub-region. So just trying to think through what the costs and time allocation would be required for that, and happy for your feedback. Thanks.
Thanks, Sarah. So Togo colleagues, do you want to take that question from Sarah? Thank you.
Yes, thank you very much, Sarah, for the question. So the partners are not yet involved, but not totally now, but they are already going to be involved, and through we involve them through the how do we call it, the term, we have some term meeting with all the partners involved in health sector. So at that meeting, that meeting was in February. So at that meeting, we involved them in the process, and we convinced them to be involved in this mapping in April. So I think normally in June we can have something very clear in the mapping tool. I don't know if I answered the question already, or.
Great, thank you, Sarah. Was that okay for you? I think you got some, and it'd be. I mean, Sarah, if you have experiences to share as well from the emerging emergency hub, it would be great. I mean, whether I know sometimes each program is mapping its own partners, and what we're trying to do is share experiences. But Sarah, do you have any experiences to share from the emergency hub on how you are mapping partners, or indeed using them for your own needs? Sarah, thank you.
Yeah, that's a great question. I think it's one of the challenges that we face, or an opportunity we have ahead, rather, to see how to do it better. There's been a number of partner forums that have been set up for COVID and then somewhat dismantled, and set up again for Mpox and somewhat dismantled. So we're trying to see how we can do a mapping of sorts to see who all to involve, and then have technical working groups for surveillance, case management, the normal pillars of response. So for something like this, I was very interested to see that obviously the public health surveillance component is included, which is great. And how can we avoid also creating more silos by just having emergency response actors and instead involve them with the broader cross-cutting routine surveillance health information systems. So that's something we're trying to approach from the hub. It's still in its nascent phase, but we'll keep you updated and probably come back for more questions. Thanks.
Great. Thanks, Sarah. Thanks. Gandar Joel, do you want to go next? Thank you.
Thank you. Good morning, everybody. Thank you for the presentation. Gandar Joel from the Ministry of Public Health, Cameroon, in charge of health information and international health regulation. I had a few questions pertaining to the tool that was presented. First, is it very different from the REMAP tool, resource mapping tool that was first initiated also by the Health Data Collaborative, for which countries have already done some few assessments, with which countries have done some few assessments? And from what I could get, it is very targeted towards partner investment. I wanted to know if the tool could also be implemented to a broader scope, like assessing the investment, the investor health coverage system of the country, or is it really just targeted to assess partner investments? Thank you very much.
Thank you. So,
Craig, I'm not sure whether it's my connection, but we lost you for a while.
Oh, sorry. I was just thanking for the question, Gandar, and just handing over to Pradeep or Aurelia if they want to answer the question that Gandar asked about the potential overlap. Pradeep, are you there?
I think,
Okay.
yeah, I'm here. I think Pandula would be a better person to answer that.
Yeah. Okay, Pradeep, thanks. I guess I think I put it in the chat also with regard to the remap. It's different because the country partner mapping tool itself focus on HIS and health data, some digital interventions as well. And I think the remap is more focused on health securities and resource gaps. So it's more, I would say it's more of a granular level mapping that happens with a different focus. Whereas in the HDC country partner mapping, our attempt along with the ministries of health, what we wanted to do was to at a higher level to see where the impactful partnerships may already exist or where there is opportunities to create such partnerships. And that's, I think, is where the two conceptually the two mapping tools probably differ. And I think there was again another question as to, what's the resource requirement to implement it? I would say almost nothing, because so far up to now, the whole mapping process in different countries have been done either led by the country office or initiated by the ministries of health, with no specific funding line or budget line allocated to any of those. So, and also the development of the tool is kind of testament to the collaborative or partnership efforts of the HDC, where different institutes have supported in its creation, in-kind contributions and so on and so forth. So the effort itself doesn't take that much of a resources or time out of partners or even the ministries of health. But the process that leads to that update or actual mapping will make use of coordination mechanisms or in-country meetings with partners. But the updating of the tool, probably in the Sri Lankan context, is about an hour's work, and sometimes that can be done online as well. So resource requirement in this instance are very minimal. I hope that answers the question.
Thanks, Pandule. I wonder whether, and just for your information, we are hoping to implement the partner mapping tool in up to 20 countries in the coming few months and share examples with that, which hopefully will go on the revamped HDC website as well. But I wonder whether the Togo team, whether you had any reflections to that question. Otherwise, I'll wrap up and ask Anne to ask her final question. Togo team, do you have any response? If not,
No response yet.
okay. Thank you. Thanks very much. Anne, do you want to, Anne, I think you might have the final question. Anne Shu, thanks.
Thank you. Thank you very much. My name is Anh Chu and I'm coordinating the work on health information system strengthening in WHO HQ, and I'm leading the work on SCORE. So just two comments. One is, this is great to see country taking it up. It's a lion's share of a lot of work to do this mapping, but it's just highlight the importance of the role of the Ministry of Health in taking this leadership. And I think that also affects a lot in how it costs. You shouldn't see it as a costing, as something that have to invest in for the mapping exercise, but it's an initial step to get an alignment of costing for the health information system. And I think it's also good that they use SCORE, because one of the major and cross-cutting chunk of the SCORE is a lot of it is about the system of the health information system, which require the leadership of the Ministry of Health. And the coordination from the ministry itself in terms of partner support and investment. So kudos to the team, if we can pick this up. And then my next comment and also question that to leave, and I think this have to be continuous, is that we are now in all the country have participated in the SCORE assessment round 2. 41 countries in Afro, the entire, all the country in CROs are participating in this. So there are lots of new questions, but as well as it's different structure now in terms of how we look at the system for health information as the core part and the cross-cutting. So how would that, how we're going to bring the new finding from the SCORE into this exercise, link with the priorities of the health information system and the national strategy. I think with the funding cuts, it's really, really important to look into the prioritizations and how health information and data can support the prioritization of the national health sector plan and the use of the data for monitoring it. So it's something to I think to leave it needs some more time, but it's for country to pick it up, and I think it's time to think about it now. Thank you.
Thanks, Anne. And thanks everyone for joining. So I just want to reiterate Anne's final question, and it's really pointing us back in the direction of not only making sure that this process is part of the SCORE process, which it is, but as countries implement and plan and look at their own budgeting and planning cycles, this is a potential tool along with SCORE or part of SCORE that could really help countries look at the partner environment, look at investments when they're reviewing SCORE and looking at really making sure it's part of their processes as well. So with that, I want to thank everyone for joining. Again, I want to reiterate the Health Data Collaborative is your collaborative. It's whatever you make of it. We value your suggestions on improving. We value your suggestions on improving this tool specifically and sharing as part of the Health Data Collaborative review.
Well, thanks, Craig. Thanks, everyone. Bye-bye.
Thank you all. Bye.
Thank you,
Bye-bye.
everybody.
Bye.
Bye-bye.
Thank you and bye.
Everyone. Thanks, everyone.
Goodbye.
Bye-bye.